are their distribution centers maintaining a quality standard so that that bottle doesn't sit in 120-degree heat, coming inactive or, quite frankly, dangerous? Amazon was issued a warning from the FDA because they had energy products that proved to have Viagra and Cialis in the product.
But a shocking boner while you're on the elliptical or something.
Form that's most often purchased off of the shelf is proven to be very poorly absorbed and
Disaster
may
pants.
increase the chance. Absolutely, may increase the adverse effects.
Hello and welcome back to another episode of the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Sherr, and it's a pleasure to be back with all of you. Today, I had the pleasure of interviewing Dr. Jeffrey Glad. Jeff is a fantastic individual. He's a clinician. He's also the chief medical officer at Fullscript. Here is a bio on Jeff. So he graduated from Indiana University School of Medicine in 2001. He then went on to train in family medicine at Memorial Hospital in Muncie in Indiana. After completing his residency, he started a family practice that encompassed full spectrum care, including obstetrics, colonoscopy, and endoscopy in Columbia City, Indiana in 2006. After some of his own health challenges, which we talked about on the podcast, he ended up completing a University of Arizona Integrative Medicine Fellowship under the direction of Dr. Andrew Weil in 2009. As he was in fellowship, he also served as medical director of Parkview Center of Integrative Medicine in Fort Wayne, Indiana. In 2010, opened Glad MD, Integrative Medicine, where he blends health promoting care with high access technology, which he still runs today part-time, as well as being the medical director of Fullscript. He's had a couple other health ventures, including launching something called Pure Health MD, as well as Midavin.com. We talked about the latter in detail overall. So he lives in Columbia City, Indiana with his wife, Neely, a nurse practitioner, and their 3 children. And he still has his partial clinical practice along with being chief medical officer at Fullscript, as mentioned, which he joined, I think, in early 2000s. So Dr. Glad and I, Jeff and I, had a great conversation on this podcast. We really talked about a lot of different aspects. We talked about Midavin a little bit. We talked about supplements in the sense of what might be, on the medication side at least, happening to people because of taking certain prescribed medications and have various nutrient and mineral deficiencies as a result of this. We talked about birth control pills. We talked about PPIs and others, and some of you may have never heard of before. We then transitioned the conversation, talked about Jeff's journey and how he became an integrative practitioner, how he learned integrative medicine, how he decided to create his own clinical practice. We then transitioned to talking about optimal labs, laboratory testing, optimal levels of various nutrients and hormones, and how to do this in clinical practice, and how clinical outcomes are more important than the absolute numbers, so trends in clinical practice when you're working with patients. We then transitioned from there to talk about supplement quality. We talked about Fullscript a little bit and how Fullscript does this, but we really talked about the end-to-end process that's really required, in our opinion, at Health Optimization Medicine and at prescriptions as well, to make sure that you're getting the best quality supplements. We're talking about everything from ingredient procurement to certificates of analysis, to third-party testing, to batch testing, to full quality testing on the actual product when it's done, and Jeff's ideas and thoughts about all of this. We then finally talked about excipients in these supplements and some things to look out for. And then finally, Jeff's 3 ways to live smarter, not harder. I really hope you enjoyed this episode with Dr. Jeffrey Glad. It was a lot of fun to record. If you like our podcast, please don't forget to like and subscribe below so you never miss an episode. Please share with your friends and colleagues, and wishing you a fantastic rest of your day. Enjoy. All right, Dr. Jeff Glad, how are you?
I'm great, Scott. Thanks for having me.
It's great to be here with you, Jeff. I was really excited to meet you at A4M and a lot of the Fullscript team with Alex as well. And I just was great to have a conversation and start chatting. I think we have a lot of similarities. We're still in clinical practice, still doing our thing, but also at the same time, trying to make the world a better place in multiple different ventures. Your first venture is kind of where I wanted to start today, which I thought would be really interesting for people to learn a little bit about. I don't know if this is still ongoing or was this project closed down? Tell us a little about it and then kind of how you got involved in doing it.
Yeah, I think you're talking about Midavin, right? The
Yes.
Nutrient depletion calculator. So, interestingly, it was sort of my second venture into doing something beyond clinical medicine. So
Okay.
My story started, very conventional, small town family MD, started practice did OB, delivering babies, did colonoscopies and EGDs, and didn't realize, but 2 years in was burning myself out
Sure.
and was, on the edge of obesity and prediabetes and taking meds for panic attacks out of the drug rep closet and
Out of the drug rep
sort of had
closet.
this awakening.
Nice work.
Yeah, no, again, dude.
Yeah.
Yeah. I mean, it started in medical school
Wow.
and then in residency. And I just didn't have enough, confidence and pride to just admit like, hey, I've got a problem. So
What were you
I was,
taking?
going in and grabbing SSRIs. So,
SSRIs. Okay.
started with Paxil and the side effects were miserable and switched to Zoloft. But yeah, I mean,
Interesting.
I'd sneak into to the pharma rep closet and grab what I needed. And it kept me in medical school because I literally debated dropping out. Couldn't go into the OR.
Mm.
And then as I got in and, needed to deliver a baby and needed confidence, needed to get through my career, kind of where I was left, but committed to nutrition. And along that way, lost 50 pounds, focus improved, energy improved, realized I don't need these medications now, and gradually wean myself off and have never looked back. That was sort of the aha moment for me of like, well, I didn't learn any of this in medical school. How do I go gather more of this information? Went to University of Arizona and the integrated program there. Actually had a buddy in residency with me who the residency let open an acupuncture clinic in the family practice residency, which was,
Wow.
mind blowing. And I don't think there's many examples of that, but I was still very conventionally focused and
Sure.
didn't give that a lot of attention. But as I moved into his world, we started a website sort of built on content, ended up selling that to the Discovery Channel
Oh, wow.
because,
Okay.
the other partners just, didn't want to keep going with it as it grew. And I just sort of got this like entrepreneurial bug. Like so spun out of, the hospital-based integrator practice, started my own, and then said, what can I do now? And stumbled upon a talk by one of my good friends and mentors, Chironi Lodog, about medication-induced nutrient depletion.
Right.
And it was just this aha of like, if more pracs had a tool to easily show to patients what might be happening simply from their medication list around nutrients depleted, gosh, what a powerful way to just start even practicing integrative medicine. So didn't find anything super accessible or usable online. So built mytavin.com, MYTAVIN, and just sort of did it with a project manager and found a guy, actually a buddy now who, builds databases and just created this online calculator that allowed practitioners or patients, quite frankly, put in their medication list, tap the database, the PubMed research and articles, and showcase what might be being depleted from a nutrient perspective. I also thought the value there was bringing in the symptoms of those depletions.
Yes.
And, as I started using that, it was a free tool, still is today. It was such an aha for patients.
Right.
A lot of times they're coming in, they're struggling. They've been struggling for years. It's more medications. This is why they seek out, your care and my care and other integrated practitioners. But to simply just start with, you're on 4 medications. They're potentially depleting 5 or 6 vitamins and minerals. Here are the symptoms of those. And you literally wrote these symptoms as the reason for coming to see. So let's start there. And so that's still, it's an ongoing project actually now inside of Fullscript. So when I came on board at Fullscript, they also bought MyTavin. So, we're finding ways to now put this into the platform, again, to arm practitioners with this knowledge and education to kind of help, improve the health of their patients.
Oh, that's awesome. I didn't realize that it was sort of another sort of R&D project inside of Fullscript, which we can talk about later. But so as far as let's stick around with the vitamins, minerals, and nutrient deficiencies for a little while, because I think even practitioners like you and me who have been in practice for a long time, we may have heard of something like metformin causing B12 deficiency. Obviously, your diuretics causing multiple nutrient deficiencies. If you've been like a gastric bypass patient and you've gotten one of those old school procedures, you're going to be nutrient depletion central is what it comes down to. What do you think are the ones that most doctors don't know of, or maybe like maybe less knowledgeable about, that are causing either significant nutrient depletion like initially or like over the long term? What would you say?
Yeah, I mean, I go immediately to contraceptives. And that
PCPs.
would also sort of, yeah, it would also be, hormone replacement. So,
Mm,
we know that these hormone replacements, and again, it's a lot of older data. There's not a lot of new data that comes out on nutrient depletion, although I'm constantly looking for
sure.
what is GLP-1 potentially doing,
Sure.
given the
Yeah.
digestive
Yeah.
impact.
I've been wondering the same thing,
There,
really, about what's going on with this, with the GLPs, but we don't have any data there yet, I would imagine, right?
there's no data there. As you know, it's the potential for muscle loss, right? So
Right.
making sure you're supporting a patient, muscularly, whether that's creatine, plenty of protein, and
Right.
again, because of absorption, the powders tend to make a lot of sense for those patients. There's probably something happening in the microbiome, I think, for sure. So as we continue to do, it's nice here in this day and age where you've got the GLP-1s. You also have a lot more microbiome science happening
Right.
than was happening, 10 years ago when I built Mitivin. So I do think we're going to have some ahas there to figure out like what is the best supporting path of success for those patients who need these
Yeah.
medications.
Yeah. I worry just on the GLP-1 side, just to kind of talk about that for a minute, because you brought it up. I think I worry about with the slow gastric emptying. And I've had a lot of patients with constipation, with abdominal discomfort. And I worry about things like small bowel intestinal overgrowth or small intestinal bacterial overgrowth potentially, and other, bacterial dysbiosis that's going to happen because you have food that's transiting time in such a slower way. But I haven't seen that. I mean, I don't see that many patients on these drugs so far. I mean, but I haven't seen that. I don't know if you've seen that in clinical practice at all, or anything that you've seen on the GLP side.
Yeah, I haven't seen it. Again, to your point, more theoretical,
Yeah.
and something
Yeah.
we're looking out for. Again, the volume of patients coming in is increasing.
Right. Yeah.
Um, and again, like there's some really great wins. I mean, I've got patients whose CRPs literally, dropped significantly down.
Right.
But they're also aware of these side effects. Either they're feeling them or they've read about them. So they're being proactive and saying, okay, hey doc, I really like the effects, the benefits of this medication, but I also know there's downsides. How do we manage those? And
How
I
to
think,
mitigate. Yeah.
to your point, proactively, optimizing the microbiome, whether that's through assessment or just sort of supplementation, prebiotic, probiotic,
Right.
probably makes sense until we have more solid information.
Right. Right. Okay, cool. So that was a little bit of an aside, but thanks for that. I think on the vitamin and mineral deficiency side, so what do you think are, so we talked about birth control pills, and actually you mentioned in there too, hormone replacement. So you're talking about men and women on maybe bioidenticals, or even men just on testosterone, or what's your sense of that?
Yeah, testosterone, I'm not aware of any data around nutrient depletion. It tends to be more around estrogen.
Right. Yeah.
And so that's where the focus tends to be. I've seen it. I don't think it's a, hey, you're guaranteed to get depleted here. But I mean, if you think about these young women, particularly on birth control pills, many of them, if not all of them are synthetic, not bioidentical. And
Right.
so you tend to see more of, B vitamin depletion, even vitamin C, folic acid, magnesium, zinc. You sort of look at that picture and say, okay, this young gal, and maybe she isn't using it strictly for birth control. Maybe it literally is, dysmenorrhea and really, and maybe even bordering on anemia.
Sure.
So is getting benefits of that medication. But if you look at those nutrients being depleted, I mean, you see migraine headache as a potential outcome there,
Right.
certainly depression as a major outcome there. And so I really think we're missing sort of medical practice in general, missing the boat in protecting these women on these medications who, quite frankly, are at risk for migraine and depression as is.
For
Might
sure.
we actually be promoting that with contraceptive pills? So, proactively either just putting them on a good multivitamin, multi-mineral program to support that, or measuring those markers to really understand what their needs are.
Yeah, I love the latter. I mean, obviously, not everybody can go and get their nutrients measured because it's not always affordable. But I think having some
Yeah.
empiric strategies can be really, really helpful here. So, what other medications would you say are kind of top on the list at causing nutrient depletion?
Yeah. I mean, you mentioned a lot of the big ones, right? You mentioned your metformin, some of your blood pressure medications. You didn't mention, but you sort of by proxy with GI surgeries, the PPIs and the acid suppressing medications, right?
Right.
Those are major players there. With even black box warnings, say for iron deficiency with the acid suppressing medications, same thing. You're seeing the B vitamin deficiencies. And I always find it in clinic, again, been doing this now for 15 years, the powerful story of, again, showing them the potential depletions, repleting them, in terms of what they need. But then the discussion immediately leads to how do I get off of this stuff?
Right.
Right. Which then is this big walk of like, okay, yeah, reflux is manageable if we sort of take the integrative approach and talk about diet and lifestyle and sleep and, probably need maybe a little more acid at times as opposed to
Right.
cutting down on the acid.
Right.
And so again, it lends itself to this type of care, uh, from the beginning part where let's just solve your symptoms and your immediate needs. But what's the longer, plan of actually not needing this extra supplementation because we want to get off the medication?
Yeah, the PPIs are a big, big group. And I always have this conversation as well. I mean, I still work a little bit conventionally. So, and we see people on PPIs for like years and years and all the other issues that you're having, you're nitric oxide depleting, you're decreasing your stomach acid. So you're high risk of GI and gastrointestinal infections. I mean, these things can be very helpful in the short term if somebody has a gastric ulcer, right? So I think the key really with all of these is context. And I think the challenge also is on education. I mean, it's crazy you were doing EGDs and colonoscopies along with doing
Yeah.
you're delivering babies at the same time. It's kind of crazy. And that's what family medicine docs, in the middle of the country, like you, I think still do to some degree. I mean, so when you're talking about these medications with your patients, it sounds like you've been doing this a long time, Jeff. Like, did you train in functional medicine itself, or did you kind of do your own thing and then train later in it, or how did you kind of create your own clinical practice around your own way of treating yourself in this? Like you said earlier, how you lost all this weight and that you were getting on this nutrition train, et cetera. How did you kind of develop this practice?
Yeah, it's a great question. In sort of, the aha again in having that personal health transformation immediately led me to nutrition. Right. Omnivore's Dilemma. Michael Pollan was sort of
Sure.
this big, experience for me in terms of the bigger view of nutrition and what does healthy nutrition mean? Because I mean, originally when I lost all that weight and felt all these improvements, it wasn't whole foods. It was, well, it was less processed food, but it wasn't
Sure.
quite, the optimal diet that we would
Sure.
sort of
Yeah.
promote to our patients.
Was it Applebee's and
And
getting the
actually,
salad or something?
what's
Sorry, you're in
that?
the middle.
Applebee's.
I just think of like being in the Midwest and going to Applebee's and getting a salad. I don't know. That's
It was the Caesar side salad and the chili from Wendy's
okay.
almost every day with Diet Coke. Like again, not
Wow.
something I would advocate for
Right.
today,
That's how you lost your
but
weight, though.
was
Yeah.
yeah. And again, like
Yeah.
I think it
Yeah.
does like
Yeah.
inform my practice today, which is meet patients where they are. Right. Like that diet I was consuming was way better than I was doing prior to that.
Right.
And
It's
I
all
saw
relative.
success.
Right.
So getting a patient to automatically follow the, sort of the perfect whole foods diet tomorrow isn't realistic. And quite frankly, you wind up losing patients because they're overwhelmed. And so I think I've always had, from my own personal experience, more of this pragmatic approach to meet the patient where they are. What's better than you're doing today,
Right.
as opposed to getting to perfection. But back to sort of the journey. Um, I had gotten, I was following Michael Pollan at the time, it's 2008, and he was speaking at a nutrition conference. That same weekend, I was supposed to go to the American Academy of Family Physicians conference, right? Get my
Mm.
CME hours, do the conventional path, learn some stuff for the board test, and I canceled it. I told my wife, like, I just feel compelled to go to this nutrition conference
Mm.
because this is where my passion is. So I went out to San Diego. It happened to be Andy Weil's University of Arizona Integrative Fellowship
Sure.
conference that Pollan was the headline speaker for. And then it was like, oh my goodness, there's an entire way to practice based on these principles. And I remember they had a big talk about the Farm Bill, which was coming up that year, and
Mhm.
how that impacts, the food supply of the American population. So I started writing op-eds to the local newspaper. I got so on fire for this, and then joined the fellowship and studied there so that I could have more of that formal training. How to understand nutrition better. but also was exposed to supplementation,
Sure.
mindfulness, and sort of this general integrative, sort of program. I've never done any formal functional medicine training, but I've been to the conferences. I started listening to the webinars. I remember my first, probably my first introduction to sort of that world was I actually stumbled upon a gluten sensitivity talk by Tom O'Brien. Do you know him?
Yes.
Yeah. I mean,
Yeah.
Tom's an amazing speaker, right? And does great at painting pictures that just make sense. Again, that sort of practical, pragmatic view. And he was talking about, that gluten sensitivity is more than celiac disease, which is mind blowing when you're conventionally trained. The next day I had a patient who was actually the spouse of a hospital executive in the hospital I was working in.
Mm.
And, migraines, chronic pain, hip injections every 3 months. And I said, you know what? I listened to this podcast last night and I wonder if you have gluten sensitivity. Let's try to take you off it. And I wasn't even sure what that meant at the time. But we did it and sort of put it together like what we're going to eat. And she comes back 3 weeks later and she's completely symptom free. And that was again, like, so my own personal transformation, then to see that happen in clinic in live time with a chronically ill patient who was very frustrated with the path she was taking. And so then, sort of gobbled up that content and what else is out there that can help me kind of shape this view. And so that's, what got me, really motivated into the type of practice that I was doing. I sort of have always had that, immune system, inflammation, gut connection as
Sure.
sort of the core focus of our practice here. And that continues today.
Pardon the interruption. This episode is brought to you by Health Optimization Medicine and Practice, a nonprofit organization training doctors and practitioners on how to optimize health rather than treat disease. Check out our foundational module, Metabolomics. Learn how to optimize metabolism, real-time levels of vitamins, minerals, and nutrients and cofactors, real-time measurement, real-time optimization. Help your patients right now truly optimize their foundation of health. Go to homehope.org, check out all of our modules, including Metabolomics, and use code podcast10 to save 10% on this module or any modules of our certification. Now back to the show. Yeah, well, that's a really cool story. I think a lot of people in the integrative space, let's call it that, got into the integrative space because they had their own health challenges. They had something that happened if they were conventionally trained, especially like you did, and like a lot of people in the conventional world. They only start looking for answers outside the box when they can't get answers inside the box themselves. And then they have to go and do Diet Coke and side Caesar salads at Wendy's just to see how things go for a little while. But I love that. And I mean, my journey is a little bit different. I grew up the son of a chiropractor. And so I was always out of the box. I saw him changing people's diets when I was a kid in the 1980s and how their asthma, their allergies would go away. He would always say that drugs were, that food was the most powerful drug that you could eat. And that was a crazy statement in the 1980s when people were drinking Tab and everything else in between. But, but like you, I think, and a lot of other practitioners, there's lots of different ways to go here. I think that people get sort of even boxed in on the integrative side that they have to get functional medicine trained or they have to get certain types of training to be able to do what they do. But oftentimes what I've found, and I'm interested in, it sounds like this is your journey. It's like you have to find the things that resonate with you the most and kind of go with that path and find something that's going to resonate, with you and your practice. And this podcast is actually sponsored by our nonprofit organization called Health Optimization Medicine and Practice. And this is a nonprofit that's training practitioners on how to optimize health. And it's an educational course, and it's different from functional medicine. It's something that could be used by any kind of practitioner that's looking to try to support their practice. I mean, if you were a conventional minded practitioner now, like if you had to not saying 10 years ago when you started or longer, like if you were a conventional practitioner now and you were thinking like, I want to start dabbling in, the integrative space, I don't know what to do. I know that we're going to talk on the supplements on one side because I think that's the other piece, but like from a clinical practice perspective, like what do you think are some things that if you knew them like earlier, you would have done them differently in the world that you're in now?
Yeah. Wow. What a great question. I probably go back to what you said, Scott, which is, I mean, even if you don't have a health concern or issue that's driving you into finding alternatives and going down the path of, moving away from conventional medicine and what else is out there. I think, simply working with an integrative practitioner or finding opportunities to get a really comprehensive blood data set done and have that interpreted in sort of an optimal lens, right?
Mhm.
And understand why you may feel fine. There may be some underlying concerns, right? Is there an inflammatory concern? Is there a metabolic concern? And then what's the lifestyle and potentially supplementation, guidance to sort of improve? Because again, like working with I'm sure you do the same thing. When I first see a patient, you're trying to figure out like, okay, where's the thread to pull
Sure.
to create the most motivation,
Right.
right? And sometimes it's just, I hate conventional medicine. I refuse pharmaceuticals. And so you almost have to take that side of like, yeah, I do too. So let's be a team and let's work here. And for some, it's the opposite, which is
Right.
like,
Right.
I'm desperate for help and I need some symptom relief and I don't have any. And so I think for each practitioner taking their own personal journey, I think is probably the most important part.
Right.
And now, like so much of this education is commoditized and out there to at least start listening to some of these KOLs and experts who, are KOLs and experts for a reason, right? They've dove into the evidence. They've done this themselves, either on themselves or in practice. And you can at least start to get, interested in pathways that resonate with you or resonate with the kind of patient population you're working.
Right. I think I love that. So KOL is key opinion leader, just to be clear, right? Okay.
Correct. Yeah.
That's
Thank you.
little jargon. Just want to make sure that I think I was like, I think I know what that means. Okay. But I think, yeah, I love the perspective here, which is that if you're starting to get interested in this, do some of this work on yourself first. I think that's obviously the best way. Maybe it's not obvious. I think it's really one of the best ways to start understanding how to interact with this world outside of the box. And most of the best clinicians that I know, and I'm guessing this is going to be for you too, will try almost everything on themselves first before they start doing things, especially out of the box for their patients. Yep. So trying supplements, trying diets, I remember I stopped gluten about 10 years ago thinking I had no issues with gluten. And then I realized when I went back to gluten, I started clearing my throat all the time and coughing. And I was like, oh, I forgot that I was doing that in the morning. So anyway,
exactly.
I'm sure you've had this experience with one of the patients, as you mentioned. So I think it's important, for people to think about this journey. And I think the other thing you mentioned that was really important as well is that you want to know who you want to work with as well. Like who is the kind of patient population or who is that patient population that you want to work with? Because I think that's going to color your education too. Do you want to do chronic complex medical illness care, which is super challenging, but can be super, super rewarding? I mean, do you want to work with athletes and focus on performance? That's a very different animal when you're looking at it and how you're going to think about it. So when you were creating your practice, did you have a certain kind of patient population you were looking for, or is it was it everybody that was kind of coming through the door, at least initially?
Yeah, it's a great question. I mean, it really was sort of everyone coming to the door, and it spanned from, I'm sort of reasonably well and just want to sort of see where I sit, on the optimal range, to the complex. And, I would say over the years, as I got busier and busier, and our practice is now 2 other nurse practitioners and another physician,
Right.
Everyone sort of has taken their own path in that realm and sort of become an expert in their focus. So we have someone who really enjoys the complex conditions and really kind of spending a lot more time trying to figure out the root cause and what's going on. I personally have moved way more into the longevity space and the optimization space, because that's what I'm living, right? So my patients love, one of their first questions always when they come in is, hey, what are you doing this quarter? Like, what'd you change? What'd you add? Because they're taking that same journey with me, right? They're cool. All on different stages. Some of them are more advanced than I am, and I'm learning from them. But that's kind of where, I always focus on, not that chronic complex disease, but I'm very happy with a nurse practitioner who loves seeing them, because, we have a community that doesn't have a lot of other integrative providers in it here in Indiana. Yeah. So, we're able to sort of cover all bases and all comers.
That's beautifully said. I think I have a lot of great friends that are really amazing at chronic complex medical illness, and I really appreciate their care. But it's not easy to get into these people, unfortunately, because there's not that many out there. So I hope there's more that will go into this world. But I tend to be sort of on your side, Jeff, on the optimization side of things. And I love that your patients are asking you what kind of things that you're doing and want to know.
I mean, education is the big one,
Yeah,
right? We
sure.
didn't learn it. So then again, like you now go try to find this education and what are the sources of your education, and how reliable is that? So, I think it always starts, and we're spending a lot more time with conventionally trained sort of allopathic traditional practicing doctors who
Sure.
sort of get what you just said, which is, I understand now the benefit of magnesium and fish oil and B vitamins. And, maybe they're using nutrient depletion as a path to support their patients. And it's take magnesium, take B12, and you write it on a piece of paper and you send your patient out, right? This is sort of,
Yep.
the birth of Fullscript, back in the early 2010s was just because of that. It is an
Right.
overwhelming experience for the patient to figure out, well, okay, they said magnesium, but there's 7 different forms and this one's on sale.
Right.
I'm going to do this because magnesium is magnesium is magnesium.
Right.
So, I think the challenge is, understanding that there are very clearly evidence-based forms that are better absorbed, which equals better clinical outcomes. And that's where, Fullscript, and we're sort of going back to the beginning. And instead of, okay, we have 30,000 different products and we can cover everything. Well, wait a minute. Let's start educating some of these practitioners that the magnesium oxide form that's most often purchased off of the shelf is proven to be very poorly absorbed and
Disaster
may
pants.
increase the chance. Absolutely. May
Yeah.
increase the adverse events. And again, listen, if you're treating constipation, that may be awesome. But most of the time, that's not what you're suggesting magnesium for.
Right.
Calcium is the same way, right? Calcium carbonate. And I've been pulling this data because of our work with more traditional practitioners. Calcium carbonate increases adverse events. It's in the American Academy of Family Physicians calcium article. The most basic education for practitioners. But again, I've skipped through that because it's a supplement and I want to know what medications to use. But now that
Right.
they're coming back to, hey, wait a minute, there's benefit here, then you've got to be a little bit more specific in your patient recommendations around form and around dosage. And, it's really the ethos of Fullscript is clinically effective supplementation. And, we can talk about quality. I know we will, but part of quality is just clinically efficacious products.
Sure.
And
Sure.
it goes right there. I mean, fish oil is a whole nother story, right? It's certainly a quality story of fish oil off the shelf versus a high quality pharmaceutical grade fish oil. But there's a major dose discrepancy in what the patients are buying versus what the high quality stuff is putting out, right? I mean, if you look at all the evidence, it's at baseline 1,000 to 2,000 milligrams of EPA and DHA.
Right.
Your patient buys the fish oil on sale at the drugstore. And if they were to really dose that to the evidence, it's 9, 10, 12 capsules a day. So your discount bottle is gone in 6 days. And imagine the adherence rates are very poor for being able to take that many capsules of fish oil.
Yeah, fish oil is a good example of a huge challenge that we have on supplement quality. But I love that where you went first was education, because we have to know as clinicians the type of magnesium to take or the type of calcium that that we should take or not take. If we're a male, we shouldn't be taking calcium in general. Or like as you said, like understanding the idea of what exactly to prescribe. But then, once we get that education, once we start getting, okay, dabbling a little bit, like this is the form of vitamin B12, I think it's better, right? So versus another one, you don't want cyanide, you want methyl or something, right? So although there's some I think interpretation question there too, but
Correct.
So then when do you think about? So the next step is, I think, would be like now that you know what supplement type you want, like how can you tell the quality of what you're getting? I mean, you mentioned a little bit this with the drugstores and things like what are the things that you're thinking about? I know Fullscript thinks about this. I know you thought about this before Fullscript, and I do too in my practice. That's why I don't ever send my patients to Amazon anymore, for example. But tell me what your thoughts are.
Yeah, I mean, again, like there has to be. There's a lot that goes into quality, right? If you listen to any, quality talk about the supplement industry, it is overwhelming to then, as a busy practitioner, go and do all of this diligence yourself.
Right.
Right. And go pull, the certificates of authenticity at each stage of the processing and the batch testing that happens inside these companies. So, I immediately, early on in my practice, sort of aligned with Emerson's quality program. And back in the day, that was the gold standard. It's now part of our quality program
Right.
because Emerson
Gotcha.
and Fullscript are one company. So, we've elevated that experience, but they spent a ton of time doing the diligence and the work and working with these brands directly. And that's one of the biggest parts is our relationship with the brand is direct, right? We're just not a warehouse that any brand can send to and then we'll ship it out. Our integrated medical advisory team is walking through each of these steps, right? The lowest bar is CGMP, right? That's this very base has to be quality. But then you've got this elevated part of, okay, well, is what's on the label in the bottle? And have you proven that? And have you made sure there aren't any contaminants and, microbial,
Right.
factors that have gotten in here, right? And an official example, the good one, like, is it oxidizing? And how are you proving that? And so this is where the benefit of third-party certification, of which there are, 20, 30 different third-party certifications dedicated to each aspect of this quality. And they don't care which brands make it or not. They only care if you're meeting those quality specs.
Right.
And that's huge, right? There's a fish and omega-3 focused one. My favorite one is NSF, National Sanitation Foundation. I find that they have the highest bar. And at Fullscript, we're bringing all that into our quality program. We're also putting it in the filters as you search for products. Like, what third-party certifications have you heard about and which ones are important to you, right? Is it the vegan certification? Because you have a patient who really needs to be focused on vegan. The allergen components become a big thing too. I mean, you mentioned gluten. Are your supplements causing your cough and your indigestion because you didn't make sure that they were completely gluten-free and tested by a third party? So this is where the reliance there happens, and really trusting the brands first and their commitment to quality and the healthcare practitioner channel, which tends to mean if it's going to meet that quality bar. Then you've got the third-party certification. And again, then you've got, well, what happens after that, right?
Right.
This is kind of the Amazon story, which is, are their distribution centers maintaining a quality standard so that bottle doesn't sit in the 120-degree seats, and becoming inactive or, quite frankly, dangerous?
Right.
So,
Right.
Our five distribution centers in the US are all NSF audited and pass every year. So that, again, this is where that quality piece comes in. This is where the direct brand relationship comes in. I mean, you saw December of 2023, Amazon was issued a warning from the FDA because they had energy products that proved to have Viagra and Cialis in the product, right?
I didn't know this.
Pharmaceuticals in your supplement.
That's awesome and terrible. But it's not surprising, right? And but a shocking boner while you're on the elliptical or something. But my goodness.
That's right.
But I love that you brought that last piece up, is I think that a lot of people in our world, a lot of people that are listening, that are clinicians, that are practitioners, that are people that are just looking to optimize their health, they know about a lot of the other steps, but they forget that the stuff sits in a warehouse for a period of time. And I remember hearing a story about Metagenics and how they were getting counterfeit Metagenics products that were getting sold on Amazon. And then Metagenics had like this huge issue where they had to go and shut down all these Amazon warehouses that were selling all this counterfeit product. So I mean, I think it's really important to think about, where you're getting your stuff from and what that whole train of, let's call it the train of custody is, right? In the sense of how you do this, because the way I think about this, and I love that you have, trusted companies like, Emerson and Fullscript and others that are doing all this work for you. But as a practitioner, you have to think about, where your ingredients are coming from in these products, right? You have to think about, are those being tested? Are they coming with certificates of analysis? Then those ingredients have to be third-party tested to make sure that they're purity and potency, their purity and potency is what they say on the label. And then also you have to check them for micro and you have to check them for heavy metals. And then when you put everything together in a capsule or a tablet or a lozenge or whatever it might be, then it has to be tested again, or it should be tested again, so that you know exactly that all of your actives and your inactives are what they say that they are going to be. So you have all these different steps along the way that are doing this. Pardon the interruption. This episode is brought to you by Transcriptions. makers of precision-dosed pharmaceutical-grade formulas in the form of a buccal troche. Check out our company, Transcriptions. Our company is all about quality. We are all clinicians. There's 4 docs on the team, including me. These are all physician formulated. We make sure that all of our ingredients are coming from good sources. We have certificates of analysis for everything that we bring in to our formulas. We then check everything again for purity, for potency, for heavy metals, for toxicity, for microbiology, etc. All of our batches are tested again for purity and potency. Very few other supplement companies are really doing this to the length of degree that we are. Go check out transcriptions.com. Save 10% on any of our formulas by using code POD10 at checkout. Now back to the show. What do you see as, looking at these supplement companies that, that you've vetted over the years, where do most supplements, I think the last thing to say before the question is that, all of this is voluntary, by the way, right? So no supplement companies have to do any of this. Like, what do you think is the step that kind of trips up most of these supplement companies when they're looking at, being on a platform like yours, or getting this, or having these kinds of certifications? Is it the GMP, or is it something else that you see?
I mean, again, I think it's some of those quality barriers, because again, you walk through this, you've been through this.
Right.
It's not an inexpensive endeavor. Right.
That's
I mean,
true.
those are big investments you have to make to have a high quality product. I think now, today, the vetting process for us, that's the bar, right? The high quality, the proof, the certificates of authenticity, the third-party certifications, those are all now table stakes. And now we're moving in kind of back to the whole movement of growing integrative medicine through clinical outcomes and proof is, do the products have end product clinical validation, right? This is what interests us more now than anything else. Not just, hey, I've got these 3 ingredients. Here's the research for these individual ingredients. We put them in a capsule. Well, okay, now I want to know, what did that capsule do against placebo? Instead of extrapolating that it probably does what those 3 ingredients did independently. Well, what did it do? And so this is now where we're sort of working with our partners and really talking about this end product clinical validation story. And we're seeing that, be more available, with different companies who are also committed to kind of helping improve the industry, running some of these placebo-controlled trials, because as you know, they're also quite expensive. To make that a little more affordable so we can have more of these trials to support these supplement recommendations.
Yeah, that's obviously great to do, but they're hard to do, right? Because we have people taking lots of different supplements or doing lots of different things. And you can't, I love, on one part, the emphasis on randomized clinical trials, but nothing is truly randomized. Nothing is truly going to give you that data that you want, because you're not really factoring people's microbiota. You're not really factoring their sleep. You're not factoring a whole bunch of things. But I do hope that some of this literature will help the conventional docs kind of sign on a little bit more, and help us kind of bridge that gap. I love how you said earlier about going from calling it integrative medicine to just medicine, right? I think that's the whole goal right there. So when you're just on the supplement side of things, and when you're thinking about deliveries, it's sort of tablets versus capsules, sublinguals, do you have a preference typically with your patients and clients, or is it just depend on the formula overall?
Well, it's a little bit of both. And it mainly is, what is my patient interested in, and what are they willing to do? Right. So it's always my first question is, how many pills are you swallowing today? What's comfortable for you? It's also budget, right? Like I don't think we probably have enough conversations with our patients around what's your supplement budget?
Sure.
Both out of pocket money spent, but also just budget of what you're willing to swallow and what you're willing to open up. And so I do see more patients gravitating to interest in forms that aren't swallowing capsules and pills, right? Whether that's lozenges, whether that's liquids, whether that's dissolvable powders, and certainly that's some of the industry trend here is formats that are more amenable, to what patients are interested in taking.
Gotcha. That makes a lot of sense. I think some of it depends on the absorption rates as well, I would imagine. So some things will be better absorbed sublingually versus, in a buccal troche, for example, like we have, or at Transcriptions or something, or a tablet or a capsule. I think a lot of people that have digestive issues, if they have gastric emptying times that are very slow, we also have to think about those kinds of things with the GLPs to go back there. One question I had for you, actually, just as I think about it, is what do you think about proprietary formulas in supplements?
Yeah, it's an interesting question. And it gets talked about quite a bit. Actually,
Yeah.
this is top of mind right now. So again, as I mentioned, sort of our efforts in moving into more traditional medical practices, I was reviewing the AMA guidelines for making supplement recommendations, which they actually have, believe it or not.
Okay.
And much of it is the quality bar and the clinical efficacy, all the things that we've already talked about that are, again, table stakes of being in our catalog, but they are anti-proprietary blends. It's very clearly spelled out. I think our concern, around proprietary blends is you actually don't know what's in there, right?
Right.
And it's a really sneaky way for a lot of manufacturers to put in 15 different things. It looks really sexy on the bottle, but how much actually is there? Now,
Right.
again, this is where that end product clinical validation comes in, which is if you have a proprietary blend and you've been able to show, and again, to your point, like there are gaps in randomized placebo controlled trials, but at least, if you could do a clinical trial showing that your proprietary blend did this, that's a different story than just sort of saying like, okay, these are 10 ingredients that had evidence, we put them in a proprietary blend. And then as we get into in the platform to hand practitioners better tools for care, it's tabulating all the ingredients of everything your patient is taking. As you build a treatment plan, you can see all the ingredients and the forms. We have this awesome feature that I'm loving right now called, excuse me, current supplements, where I'm asking my patients the week before their visit to populate their supplement list, taking pictures of the bottles, and that uploads and taps in 90,000 product NIH database. So whether you got it on Fullscript or not, I get to see everything you're taking. The proprietary blend doesn't tell me anything, right? It just tells me a name. It doesn't tell me a dosage.
Right. Yeah, that's my major issue with proprietary blends. It's interesting that it's in the AMA guidelines. I didn't know that, but it's one of those things. If you have 4 grams or 400 milligrams of 20 different proprietary things, do you have 399 milligrams of one, and you have 1 milligram of everything else? I think it's a very sneaky and very it's a cop out, I think, especially for supplement companies that like ours and others that are really trying to do. I mean, I guess there might be some reasons to do this, right? If you have some sort of root extract or something like that, where you're getting a bunch of blends and maybe the actives is part of that. But I think, like, for example, kava is an interesting one. Kava is something that has kava lactones, which are the active ingredients in the kava, but it's also going to have kava plant as well. So if you have like a 30% kava lactone concentration, yeah, 70% is going to be plant matter, and you're not going to be saying what that is, for example, right? So I think there may be some reasons, but in general, that's my feeling on proprietary formulas too. It's difficult for me to prescribe them, but I agree with you, what you said, that like if you see a clinical outcome that's improving, and I know there's other companies, like there's a company, Radical Science, out there that's trying to do these supplement trials and try to give people and these supplement companies additional information so they can actually claim certain things, like this proprietary formula, in their case, in this example, does XYZ. I think that's a good idea. One more question on supplements before we wrap up would be, if you're looking at the supplement bottles for most of your patients, whether they're getting it on Fullscript or anywhere else, what are the major things that you're looking for that you're like, oh crap, this is terrible, like you should not be putting this in your body, kind of deal? And also, even the ones that are in there, like usually like stearic acid and others, do you think there are ones that some people need to avoid? Because certainly there's, I have clients that are on 30 supplements a day sometimes, and they're getting a lot of whatever else is in those capsules. Like, how do you think about this? And what are some of the ones you're like, we got to get out of these, got to get rid of these kind of things?
Yeah, it's a great question. And I think, we're also doing work on sort of the research behind excipients and their potential impact. But I would say, my guidelines, over the years, originally had all my patients bring their bottles in, right? And now, now that they're populating that on Fullscript, I can easily see what those ingredients are. So I screen, for some very key features to educate my patients. So, we've already talked about what is the form of magnesium you're taking. Is it oxide? Because that's a lower quality form. Calcium, is it carbonate? Lower quality form. Vitamin E, is it DL-alpha tocopherol, which is a synthetic vitamin, which again has been shown to be very poorly absorbed, almost ineffective. What's the dose of EPA and DHA? And then as you look through those excipients, I'm looking and flagging for things like polyethylene glycol, dyes. which have lessened over the years, but are still very present in a lot of commonly taken supplements.
Sure.
And again, like a lot of times I'll just read the excipient label to the patient. It's just like, wait a minute, why is this in here? And why is that in there? So those carrageenan is another one that, should be shown to be an irritant to the digestive tract. So those are the low hanging fruit, if you will,
Sure.
the things that I'm looking for when I'm walking a patient through their supplement list.
Or the 5 grams of sugar per gummy.
Exactly. Right. You've got more sugar than you have any active ingredient here.
Right. Exactly. Yeah. Well, Jeff, I really appreciate your time today and going through some of this with us today. I think it's a really important conversation, talking about the whole arc of what we've discussed. I think last question for you to finish up is the question we ask all of our guests, as I think it's an important way to kind of round things out. And you have a lot of great experience, both personally and professionally, both in clinical practice and being the medical director of a very large venture-funded company that is blowing everybody out of the water in a good way, in a very good way, in a very excited way. And I'm definitely been a fan. So, what are the 3 ways you think anybody can live smarter, not harder?
Awesome question. Well, I'll just use sort of what again, like what works for me.
Yeah.
Right.
Perfect.
And I think, it is making sure that there is dedicated time for real exercise. Right. I think that's a
Exercise.
part that is missed. Right. Like that people say, well, I'm active. I walk. Right. There's a difference between not sedentary and exercise. So, when I made a commitment, gosh, now 8 years ago, to go to a personal trainer and just challenge me with heavy weightlifting, my health, my mental health, my emotional health, my sleep have all been significantly better. And if I take a week off, I see the problems there.
Yeah.
I think second would be, so many of us that practice in this way live on an island in our own community and don't really have a good professional colleague network to connect with. Right. So go find your tribe, find your community, whether that's at conferences. I mean, for me, that was the University of Arizona, like the alumni meetings, the conferences is always the big gathering. And now, I have a lot more excitement going to conferences to hang out with my group and my community than I do getting educated. So I think that's a really big one too.
I love that.
And then you've got to find opportunities to just press pause in your day and, do nothing, although nothing may mean spending just really quality, uninterrupted time with your kids or your spouse. Because I think now with technology and everything's coming so fast and emails, I mean, we talked about it before we started, like, do we have all our pings and buzzers off before we get interrupted, because they're everywhere. And so, that can't go unsaid. Even 10 minutes of just sort of this dedicated pause of no interruptions, breathe, chill, take a power nap, whatever, like that's a really critical element of self-care.
Yes, that's a beautiful one. That's one I usually will always describe when I'm getting interviewed for podcasts is find time to just chill the F out, right? Even if it's just for 2, 3, 5 minutes or whatever. And I love exercise. Exercise is great. I love the idea of having a collegial network. I think that a lot of us get siloed and we feel like we're like living in a vacuum sometimes, especially if you have a busy clinical practice. So great ones, Jeff. So where can we learn more about you? And obviously we talked about Fullscript throughout, but tell us a little bit more about what you're up to and where we can learn more.
Yeah. I mean, again, I still practice, 2 half days a week. But most of my focus is on Fullscript. So if you want to reach out on LinkedIn, love to have a conversation and help you along. But, everything we're doing at Fullscript, I tend to enjoy being a part of, as the chief medical officer. So, follow us there, lots of really, really cool features for practitioners to optimize their care. And again, use Fullscript as self-care too, right? Get your own personal, high quality supplement protocols as well.
Yeah. You get a wholesale account and you can start ordering for yourself. And I certainly have done that many times for the family here and for myself personally when I try a new product. That's for sure. So Jeff, thanks so much for your time. And I wish you a most excellent rest of your day.
Yep. You as well, Scott. Thanks a bunch.